Let me switch topics now and ask you about the health of America's children. I'm wondering how closely you've looked at the effect of social media, big tech, social media, and AI on children's health. And I submit that this is increasingly becoming a public health crisis. Here's what I'm thinking. I've heard from parents who've testified before me and other committees that I chair that their children have been led to experiment with suicide and ultimately self-harm, and ultimately, in many instances, sadly, carry out plans for suicide at the behest of AI chatbots. The data on social media and children's mental health, children's physical health is astounding. Is NIH, here's my question, is NIH studying the effects of social media, including AI-driven social media, on children? Are you looking at that linkage from a health perspective?
I've seen those reports also, and as a parent myself, tremendously concerning to me. The NICHD, the National Institute for Child Health and Development, has a program on this, although specifically on AI and suicide. I'd have to look to see, but that's a focus to make sure that our children grow up in a country where they're not exposed to those kinds of dangers, and we're going to have excellent science on that. If we don't already, we'll make sure that to focus on it.
Good. We desperately need scientific focus on it. We need good science on it. We need good data. And I will just tell you, as a parent, I've got 3 children of my own. 3 pretty small children. And when I talk to my fellow parents and when I look at the numbers, I mean, in a recent study, 84% of parents said that they were very concerned, or at least somewhat concerned, about the effects of social media on their children. And when you talk to parents who have had chatbots urge their children to harm themselves, harm family members, harm parents, or heaven forbid, take their own lives, this is a crisis, and it's not an isolated crisis. It is a systemic crisis in every school, and I dare say in almost every home across the country. I think we need to have a comprehensive look from a data perspective and a science perspective of what this is doing to our children, so we can figure out what we're going to do to protect kids and protect parents.
I entirely agree with you, Senator.
Thank you, Mr. Chairman.
I think I see an RFP coming.